We always begin with a thorough exam. This includes checking the heart, lungs, and gut sounds on both sides, as well as taking the horse's temperature. This ensures the patient is healthy to undergo a surgical procedure under general anesthesia. Dr. Stephanie then gives a light standing sedation so he is nice and relaxed, while our technician Taylor sets up to prepare a sterile site for his IV catheter placement. Taylor sterilizes using a diluted surgical scrub. She scrubs and scrubs and scrubs. We place an IV catheter for all castrations so that while our patient is under general anesthesia, we have easy access to his vein in case more sedative needs to be administered. This makes the surgery and anesthesia a safer experience for both the patient and surgical team. Taylor administers a lidocaine block so that our patient does not have to feel the IV catheter since it's such a large needle. To keep the catheter in place while the horse is lying down during the surgery, Taylor sutures it in for some extra stability. Finn is now ready to head to his surgery zone. We walk out to the designated area with one handler at the front of Finn's head to guide him, and another handler holding his tail to assist with balance. Once in the desired position, Taylor pushes more standing sedation to make sure the patient is unaware of his surroundings. We are looking for a low head and relaxed ears. This helps with a smoother anesthetic induction. Now that Finn seems well relaxed, a combination of 2 different drugs are given to induce him into general anesthesia. During this process, the horse loses consciousness, which allows him to lie down. The anesthetic dose is given, and typically within 5 seconds to 1 minute, Finn will want to lie down.
Ideally, he'll just kind of fold his legs and sit back where he is, but sometimes they will stumble backward or to the side. Just try to direct him a little bit. In the hospital, they'll have them between a wall and a swing board so they can really place them specifically. Good boy.
Taylor arrives with monitoring equipment and covers to protect the eyes and face during the surgery as Dr. Stephanie and Dr. Christina stabilize Finn into position. There are different ways to do this for an anesthetized horse, all due to the surgeon's preference. We prefer to prop the horse up on their back and stabilize using straw or hay bales, as this allows the surgeons to have an open view of the surgery site.
Good to walk? Yep.
Dr. Stephanie prepares a lidocaine block to each testicle before opening the surgical site. She scrubs to ensure sterility. Taylor will monitor Finn throughout the surgery to ensure he maintains a proper plane of anesthesia. If the horse becomes too heavy under anesthesia, there can be adverse effects. However, if he becomes too light, he could potentially wake up during the surgery, which could be unsafe for the doctor and the patient involved. Unlike hospitals with monitoring equipment, all our technician has while doing field surgery is her stethoscope, her eyes, and her hands. The main indicators she is checking on are eye position, reflexes, gum color, capillary refill time, heart rate, and respiratory rate. Taylor and Dr. Stephanie are in constant communication with each other throughout the entire procedure. Even though we are not in a hospital setting, we try to make the surgery site as sterile as possible by recreating the same preparation techniques. Dr. Stephanie places her drapes, prepares her instruments, and she is ready to make the first cut.
Various accepted surgical methods and approaches exist for an equine castration, depending on veterinarian preference, patient age, breed, and size, and the available operating environment. I begin the surgery with one midline incision to gain access to both testicles and the scrotum. A small amount of scrotal skin is purposely removed with the incision, which will help improve post-op drainage. Now I'm isolating the left testicle, first with a scalpel blade, and now I'm manually removing the outer fascia around the testicle and spermatic cord to better expose the cord for clamping and suturing. The cremaster muscle is separated from the cord, and an emasculator instrument is placed on the cord. This instrument crushes the tissue to stop blood flow and cause clotting. Another emasculator is placed on the cremaster muscle. The crush is left in place for 2 or more minutes depending on the size of the horse. The cord and muscle are cut to remove the testicle. While the crush is in place, an absorbable suture is placed around the cord to apply additional security against bleeding. Whether or not a suture is placed depends on the size and breed of the horse as well as veterinarian preference.
Using the information she gathers while monitoring, Taylor is able to make the decision whether Finn requires a drug top-up to maintain an ideal anesthetic plane.
The same process is repeated for the right testicle.
Taylor also gives some IV pain medication so that they have already kicked in by the time Finn wakes up.
After an appropriate amount of crush time for the patient size, the emasculators are removed from the spermatic cord and cremaster muscle. The right and left sides are visually inspected for any excess bleeding. Any small pieces of fascia at the incision edges are trimmed away and the incision is stretched to allow better drainage.
Okay, so I'm going to take these drapes off of him. We will get things cleared away so that we can roll him. Legs were that way, right? Yeah, legs were that way. We're going to roll his legs back the same way they started. The skin stays open to drain. The suture on each cord will be absorbed.
So expect it to stay open like that.
Yeah. I'm going to move his lower leg forward, and that helps take some of the pressure off of his shoulder and his nerve. There's a soft tissue layer around each testicle called the tunic, and I'm going to snip that open so that we can actually see the testicle and the blood vessels and the epididymis. So now that that tunic layer is all reflected back, we can see the blood vessels leading to the testicle, and this is the epididymis where the sperm mature after they've developed in the testicle. This, if it was accidentally left behind, would still produce some testosterone, so we don't want that in there. And we'll check the same for the other side. Same thing here, blood vessels, testicle, epididymis. Everything's there that we do not want to leave behind.
Once we know Finn is safely standing and will not require any more IV medication, we remove the catheter. The doctors take their time slowly walking Finn back to his stall, where he will spend the next 24 hours recovering in a confined area. After that, he will have 2 weeks of rest with light exercise and anti-inflammatory pain medication to aid in the healing process.